Welcome to TotalMD. In this video we will show you how to chart a note and also how to create orders and how to use the billing functionality from the ledger. Welcome to TotalMD. Our electronic health record system comes with some brilliant functionality to enable you to get through your note quickly. To create a chart note, do the following. First, go into the patient's record from the patient's list. From here you can see all of the patient's demographic information as well as required meaningful use concepts. You also have access to the encounter summary. From here you can see their patient's problem list, any differential diagnosis you might be considering, as well as any encounters the patient already has. To create a new encounter, click on New Encounter and choose a template. These templates can be custom created for you, or you can use some of the templates that come with the program. Simply click on Use Template and that will populate the information into a chart note. From here you can create a chief complaint. So let's say this patient's having some allergy issues. Here we'll indicate that this was a transfer of care. Maybe the patient had to go to the hospital last night for some allergy issues. Additionally, maybe the patient had some medications that they were given. So let's do some medication reconciliation, another meaningful use requirement. From here we'll pop into our prescription and then we'll go into our medication list. From here I can add in a medication. Let's say they were given some high prescription strength allergy medicine. Let's go ahead and add that information into the medication list. And also let's indicate any allergies or check up on the patient's allergies if the patient has any. Alright, so now we've got the information that we need. Let's go ahead and move on. From here you can add in the vital information. And then we'll comment on their smoking status, another meaningful use requirement. Next, let's drop into the review systems. Here we can quickly go into review of systems, which I call our click-through. Here I can simply double-click through the information from our review of systems. Next, let's drop into the medical history. Again, we'll work through the click-through note. Part of what makes TotalMD so powerful is our ability to use different types of methods to create an exam note. Once our staff is done with our review of systems and our medical history, we can drop into our history of present illness. Notice that we have three different kinds of templates we can use for our HPI, either text, automated, or click-through. Text will simply spit out all of the text and the normals that you might want for a particular note. Automated will allow you to double-click through the note. So here, for example, it automatically goes to the history of present illness section and allows us to start to document our note. And then I can just fill out this little form. Notice that I can just double-click my way through the note and indicate any problems that are being had by the patient. The click-through option is a little bit different. Here I'm just choosing an X or a blank for each item here. Once I've finished with my HPI, I can move on to the assessment and plan. From here I can add a template for an exam. We'll just click on Use Template. I can even expand this section and drop right into text if I want to. The nice thing about using this method is that you can just drop right into that text and modify it. So let's say there was a problem with their eyes. I could simply delete this. And just drop in an X where it's applicable. These templates are completely customizable. So rather than having to use a particular method that we're demonstrating today, you could actually create your own template and use the data entry style that you would prefer. We can also create these templates for you per your preference. Then that will save that very quickly into your note. This is a very quick way to do a note. Also, I can drop into my spirometry if I need to. I also have an alternative method to fill out the spirometry form, as opposed to going in and clicking and typing. Our system is very capable in terms of being able to document procedure notes for different types of procedures or tests you might do in your office. These can be set up very easily through our template system. Here we can drop into our diagnosis and assessment. From here we can pop into this list and then populate a diagnosis from the right hand section over here. You can also populate a differential diagnosis if you think one might be applicable or needed. And then you can document the plan. From the plan template, you can simply drop into some automated text, or you can use one of the click-through options. To go through the automated option, just click on that, and we'll just click our way through our note. We can also document the procedure that was performed as well as our office visit. We'll revisit the coding later in the video to show you the transition from the EHR to the ledger. And we can also provide the patient with some patient education. Here I can drop into this note and click on View Document. This will bring up the web, and it will allow us to print off the patient education that we need for the patient, or if we go back into the application and indicate that we provided that to the patient, then it will register on the patient note. Over here on the right you can see the patient note and everything that's been documented. And here we can see that the patient education is there, as well as the URL for the patient education on the web so that they can look at it when they get home. From here I can also put in any additional orders I'd like to include with the plan. Here I can document the diagnosis that I'd like to have checked out, and then select some of the labs that are justified for that diagnosis. Here I can assign a lab to a nurse on staff. I can even put in some reasons or notes into that lab. Here I can document what outside labs I would like to have ordered as well. Let's assign responsibility to the nurse as well for that one. Let's put the expected date on this one out to the 23rd. We could also refer the patient back to or over to Dr. John Doe here, and we'll assign the responsibility of that to the nurse. We can also put in a due date here as well, and here we can also recommend a follow-up. Next, we'll go in and sign the encounter. and print our clinical summary, which is one of the meaningful use requirements. And here I have my patient note. I can also create a printout that tells the patient what they need to do for all of their lab orders. So here I have my in-house lab, my out-of-office labs, any referrals, and any follow-up that I'd like to do with the patient. Once I'm finished, I can also check on my coding. Let's go back into that note and make sure that we can transfer that information over to our billing system. So here I'm going to go back into my notes and review. I'm going to indicate that I performed this office visit code, and maybe I'd also like to bill for some other tests that I may have performed in the office. Does your clinical staff ever leave out important coding? Here again I can indicate that I've performed that code, and then I'm going to again sign off on this. So now I've indicated that I've performed procedures for that patient. I can go into activities now and click on encounter charge entry, and it will create a bill for those new codes that I just added to my chart. From here I can post those right into my ledger. So here I have bill number 2 for Grant Williams. I'm going to post all of these, and I can go right into my ledger and there's Grant Williams. From here I can complete my billing. It's really nice to have one integrated system so that you don't have to worry about separate links to make it all work. Thanks for watching the TotalMD EHR video tutorial. Call us today for a personalized demo and price quote on how we can integrate your office and streamline your clinical and administrative workflows today.